have a harrowing time on ground at vaccine centers. There is a big political fight that's going on. Congress Party and Congress Party MP Rahul Gandhi has now written to the Prime Minister spelling out the problem that there is with us exporting vaccines, spelling out strategies to deal with vaccine shortage, saying that we must put a pause on our exports and open up vaccines to everybody in our country. But the central government that's been saying that there is no vaccine shortage has only hit back and reminded Rahul Gandhi, why don't you go and deal with your own state government and the Vasuli charge against them? Effectively talking about the Maharashtra government and the soup that it is in. So this is the fight that's going on. But there has been so much conversation, viewers, regarding India's export policy. The fact that we've exported 6.5 crore doses while we've given in our country roughly 9 crore doses. And at a time when we know there isn't enough for everybody, should we be doing that? But let me put this in perspective for you. We are not just giving away 6.5 crore because we are large-hearted like that and we want to be the saviors for everyone. Some of it was also essential in a sense. So if you see the breakup of that 6.5 crore or roughly 6.45 crore, about 1 crore has actually gone as grants to the countries. This is our gifting. This is our grants, our country and our government deciding that we want to help out the poorer nations, the nations who don't have enough vaccines or access to vaccines and want to help out their people. We've given as grants 1 crore doses. Then there is the COVAX initiative. That's actually a WHO initiative and we are part of that. The idea is to again help out poorer countries, especially from Africa and Latin America, and sending across over 1 billion doses from various parts of the world. Of course, a large chunk of that goes from us. So we've given 1.82 crore under the COVAX agreement. And then there are commercial agreements that the vaccine makers would have done. And under that comes almost more than half of this, which is 3.57 crore doses that have been given. So is it fair to question the vaccine Maitri policy of our government? Is it really all onto the government? Is it so bad to try and, on humanitarian grounds, help others? Or like our previous panel guest was saying, we first need to look out for ourselves. We first need to fix our own problem before we help others. Just like they say in a flight, wear a mask first yourself before helping the one sitting on your side. Let's open it up to debate. Charu Pragya, spokesperson for the BJP, Dr. Shama Mohammed, national spokesperson for the Congress Party, Atishi of the Aam Aadmi Party joins us this evening, and Neelam Deo, director for Gateway House, former diplomat, also with us this evening. So let me actually start off with Atishi. Atishi, much has been said about India's export policy and why have we exported 6.5 crore. But a lot of it are actually commercial agreements. Can we hold the government accountable for that?
I think what we need to understand, Tanvi, is that yes, absolutely, it is a good policy to help your neighbors, but you only help others after ensuring that your own people and your own citizens are taken care of. You know, everyone says, for example, charity. Charity begins only once your own family is taken care of. And I think that is really what the larger concern here is. We are hearing day after day stories about how people are not getting the vaccine. Someone went for a vaccine appointment in Ghaziabad, and when they reached there, they were told that there are no doses there. And one is hearing stories like this every day. So why is it? The question definitely remains that why is it that the government wants to make itself as a savior for nations across the world before taking care of one's own country? Now, New Zealand has yesterday put a hold on people traveling from India. Why? Because India has such a high number of cases. Why? Because despite being a big vaccine manufacturer, we are not taking care of our own citizens. Compare this with other countries. Look at the United States. The United States has bought vaccine from Pfizer, from Moderna, from AstraZeneca, from Johnson & Johnson. Why? To ensure that it has supplies for all its citizens. Isn't that what the Indian government should have been doing? First, prioritize Indian citizens. Once Indian citizens are taken care of, then we can begin to give the vaccine to other parts of the world.
Yeah, so we should first fix our own problem before we take it to other parts of the world. Let me actually ask this question to Neelam. Neelam, a large part of this is also diplomacy, and not just to say what we want to do as a nation in terms of helping out few other nations, but even as a large responsible country considered as a pharmaceutical hub, if we are part of the WHO initiative, is that something that we can really grudge the government for?
So I think you have to look at it in a slightly long-term frame. This is a huge crisis, but the world will go on. So government cannot take all its decisions as if this was onion exports or something. This is a much bigger thing. We should be taking care of our own citizens, and I think the government is certainly trying to. But we have also signed contracts, we have given undertakings. And please remember that pharmaceuticals is not something you make quickly at home. It is part of a supply chain. If we stop supplying to countries all over the world and fulfilling our contractual obligations, what prevents other countries from breaking their contractual obligations to us? Because we import some things for making these vaccines, for the vials that are produced, in which they are filled in and then distributed all over the country. So I think you cannot be too much knee-jerk about this kind of thing. And you have to have a longer-term time frame in trying to fulfill some of the obligations, but as government has actually done, slowing down the exports so that you can meet your your domestic requirements. Now, as it happens, there is a big surge in Maharashtra, in some other places, and there are localized shortages. But overall, I understand there is no shortage of vaccines.
That actually open to debate, and but because the central government won't really give us all of the data right now, we are only going basis some assumptions and doing a math that shows that if the manufacturers say they can only make 6.5 crore per month, the government says we have 4.5 crore in the pipeline, there isn't really much to go with if we start stepping up our vaccination, which is what is happening. All states like Maharashtra and Chhattisgarh, almost every other state, as they see the number of cases rising, they want to step up on their vaccination. And Shama Mohammed, that's brought us to a stage where we are now discussing not enough vaccine doses as the states want. But is it then fair to question our export policy? If you look at the breakup, only 1 crore odd doses were actually given as grants or gifts. The rest were other obligations.
See, like every country in the world, we need to be most important is our citizens, not the image of a single man to show that he's a statesman. His only thing about Mr. Modi is to show that he's a great statesman. Now, we have vaccinated nearly 9 crore people, but the export is 6.045 crores. And out of that, 1.04 is as gifts. I mean, believe it or not, what about your people? We have a huge population. The US is not exporting, they're stockpiling. Everybody, including England and every other country, is thinking about their citizens first. I really fail to understand that why are we thinking of the others? Number two, now they were finger pointing at the Congress party today. The Congress party is not, questioning. But let me tell you, Biju Janata Dal has always been supportive of the present government, the BJP at the center. Now, Biju Janata Dal, the CM is saying, what is he saying? That we are very short of vaccine. I have been asking the health ministry, but to no avail, no response. We have vaccination for 2 more days, and they have closed 700 centers. I mean, this is not a Congress-ruled state. So there is shortage in Chhattisgarh, there is shortage in Rajasthan, there is shortage in Andhra Pradesh, there is shortage in Delhi. So, and yesterday, the Prime Minister says, Tika Utsav, he says, we are going to be doing this on a particular day. And he says more testing. Maharashtra has been testing, and that's why we have number of cases are high, because when you test, you get to know the truth, unlike the BJP ruled states. So what we are trying to say is that in Maharashtra, they're vaccinating around 3.9 lakh people a day. That's nearly 4. And where are the vaccines? We need more vaccinations over here. But the center approved yesterday 7 lakh, and today they made it 17 lakh. Whereas Haryana got around 35 lakhs and Gujarat got around 40 lakhs. So what we are trying to say is, where there is concentration of more patients, let the states decide. Give you up. The center is procuring the vaccination, it's distributing the vaccination, it's saying which age group has to be getting the vaccine. Everything is decided by the center. Why this red tape? Let the states decide. And also the center should see to it that where there are more number of cases, send vaccination to those places. That is what Mr. Rahul Gandhi has been saying from day one. I mean, last year, let's understand, February was the first tweet. Mr. Gandhi said that, this is going to destroy our economy as well as our people if we don't take it seriously.
That's fine.
And that's what happened. The strategy, what was the strategy of the central government in vaccinating? Where was there a strategy? There was no strategy. Okay, it's just about...
I'll get Charu Pragya to respond on that in just a bit.
The important point is about mouth masks. Now, they are saying we maintain social distancing, everybody wear mouth masks. My question is, I saw a rally of Mr. Amit Shah today. I mean, there are hundreds of people out there. What is Mr. Amit Shah doing? I mean,
well, I'm sure there will be rallies of Congress and your allies and the left in West Bengal as well. Let's not forget, in West Bengal, everybody will be doing that. Just like everybody did in Assam, or Tamil Nadu and Kerala. So let's not go there, because no political party can act holier than thou.
We are not in power. It's the Prime Minister.
Can I come in, please, now, Tanvi?
We are not in power.
Doesn't matter. You still got to follow the rules. The rules are the same for everybody for COVID. You broke the rules as well.
I love that excuse, Tanvi. I love that excuse. We're not in power. We can do whatever we want.
Okay. One at a time. Okay, one at a time. So, Shama Mohammed, let Charu Pragya respond to it. And please, may I just remind our ladies, a lot of the conversation we are having today is the export part of, if we needed to export all of this, and what are we doing about it today? Should we stop? Charu.
The people who were opposing the lockdown all this while are the ones who are implementing it today. The people who did not believe in vaccination, those who called it a BJP vaccine, in fact, are now calling out for vaccination for all. So I'm very certain, just give it a little more time, these very same people will start saying vaccines need to be exported, and I'll give you solid reasons for that. We're all aware, out of 195 countries in the world, 5 or 6 are producing vaccine. We are actually a part of an initiative called COVAX. It's a global initiative aimed at distribution of equitable vaccination for the whole world. Also, this is a time when India is sending a loud and clear message to the world that we have arrived, we are a power to reckon with, and you need not be scared of whatever destruction is striking all of us. Let's also remember that if one person is kept safe, he's not really safe till everyone is kept safe. COVID is evolving. COVID is rapidly traveling. And if we truly want to be safe, we need to work on making the world a safer place. What sort of thinking is this? In any case, now the export of vaccines has been considerably cut down. More than 9 crore vaccines have been administered in our country, and more than 4.5 crore are in reserves today. Also, let's remember that when we talk of numbers, India is the fastest country in administering vaccine doses. India has shown incredible numbers in the number of people we have reached through our vaccination program. This is truly and genuinely the world's largest vaccination drive. So I do not understand our opposition, which changes its goalposts and its viewpoints every single day, finds a reason to find a problem with this as well. Okay. And let me remind them, whether it is the state of Maharashtra, whether it is the state of Gujarat, they have been given the maximum number of vaccines. They are 2 out of the top 3 states in our country who have received vaccination.
Yeah, but you know, Charu, you gave them highest number of vaccines. But the truth is that 80 vaccine centers are shut in Mumbai today, 100 in Pune. and the situation's no better elsewhere. So we need more vaccines at the end of the day, because people are queuing up for their second dose. Now, before I go back to Neelam, let me quickly get our political representatives to respond to Charu, and then we'll come on some more facts as well. Atishi first, and then Shama Mohammed.
See, I think, Tanvi, what the BJP really wants in this has come out very clearly in what Charu Pragya just said. That we are sending a message loud and clear to the world that India has arrived. That is what the Prime Minister wants. He wants to send out a message that I have
We are the fastest country in administering COVID doses. Did you miss that point?
Charuji, I didn't disturb you.
You have entirely missed the point.
Charuji, please.
We are the fastest country in administering COVID doses. You totally missed that point.
Charuji, please wait. We are also one of the countries in the world with the largest population. So given the current rate at which we are administering the vaccine, it will take 5 years for India's 2 billion population to be vaccinated. So therefore, it is clearly a problem, number one. But the Prime Minister doesn't care about the people of India. He wants to send the vaccine to Pakistan. He wants to send the vaccine to Afghanistan. You are telling me that we are part of a large initiative and we must export. Can I ask you, why is the United States of America not exporting its vaccine? Why is it that the United Kingdom is not exporting its vaccine? They have populations, not even, the Great Britain has a population not even 10% the size of India, and yet they are conserving their vaccines for their own country, and not just what they are manufacturing. They are also importing vaccines from other parts of the world. Why is India not allowing private import? Pfizer, Moderna.
Tanvi, I want to respond to this, please.
So it is very clear that the Prime Minister just wants brownie points across the world. There is no concern for the citizens of India. 5 years it is going to take to vaccinate Indians.
No. Let's not go there. Atishi, let's hope it doesn't take us that long, and we do it faster than that. The way things stand, it definitely looks like we will have to slow down a little, because we don't have enough right now.
We have in 3 months we have vaccinated 9 crore people. Over the year we'll vaccinate 36 crore. So to reach 2 billion,
but we took about a month to do the first crore, and then we very quickly within 3 months reached 9 crore. So the pace is picking up. One minute, please. Ladies, let's do it in a. Let us do it in a polite manner where everybody gets a chance. Charu, you will have to respond to Shama Mohammed as well. Let her make a point, and together you can respond to everybody. Yes.
So Charu is telling over here, let the Indians die, but we at whatever cost will have to export this vaccine all over the world. I mean, that is shameful, Charu. For us, for our party, and for every Indian here, the most important is Indians, not anybody else. We need to be selfish. Just like America is selfish about its citizens, Indians have to be selfish. It's not the image about Prime Minister Narendra Modi. And let me be very clear. Last year, what did he tell us? You hit the talis. Then he mentioned to us, you know what? This is like Mahabharat, 18 days we will fight this. Mahabharat was fought in 18 days. In 21 days, it will be over. What did Niti Aayog say? On May 16th, there will be no more cases after May 16th. I mean, what are we seeing from this government? Completely lost it. When Rahul Gandhi said from last February to 2020 that we have to be very pertinent. What was happening over here? There was the Trump was arriving here. There was Namaste Trump. There was Operation Lotus in Madhya Pradesh. And then we had a lockdown in 4 hours where other countries were giving 4 days. What did we do to the migrant labor crisis? Nothing. We allowed them to move after 3 months. They stayed in places where they got
besides the point. Can you please let me respond, because this is just wasting.
No, you have to listen. You have to wait. No. You are nobody to decide. There are others sitting here. You are not the anchor. Tanvi is the respected anchor, and she will decide who will speak. Not you, and tell others are wasting your time. Do you understand that? Just because you're on the government, don't be arrogant.
Okay. Finish your point. Shama, don't get detracted. Finish your point quickly, please.
Nobody. She can't decide whether who should
finish your point quickly, please. Yes.
Yeah. So what we are trying to say over here is, it is not just the Congress party. Like I pointed out, there is Andhra Pradesh here. It is run out of vaccine. And let's understand one thing. The vaccination, instead of saying yesterday that we need to do more testing, which most of the states except BJP states are doing, The Prime Minister of India should say vaccinate, vaccinate, and vaccinate. Because what happens when we vaccinate is the symptoms, as a doctor, I can tell you, the symptoms will be less. You're not going to die. That is the most important thing. Yes, you might get COVID, that is understood, but you will not, it will be with less symptoms, just like you might get chickenpox after you take a chickenpox vaccine. So, but what did the Prime Minister say? And then what does Amit Shah say today? Today he says, we have no shortage of vaccines. Then we hear the person who provides vaccines, that is Mr. Adar Poonawalla, saying we need more funds. I want to know, what did you do with the PM Care? Where is PM Care?
Okay. No. Now we're just going all over the place. Let's keep it sharp and pointed so you can get exact answers. Let's keep it sharp and pointed.
Why don't we get Moderna? Why don't we get Pfizer? Why don't we get?
So that's a fair question to ask. Now, Charu, we don't have enough to keep up pace, and every state government wants to pick up pace for vaccination because COVID is spreading. What are we doing about it? It doesn't help when the government continues to be in denial of this vaccine shortage.
Tanvi, thank you for being a voice of sanity on this otherwise very screamy show today. But coming back to the points that were raised by Atishi ji and the Congress spokesperson, who I couldn't make much out of because she was screaming more than communicating.
No personal comments, please. Let's stick to the point here, Charu. No personal comments, please. Let's stick to the point at hand.
I'm sorry. You will not speak if you're going to insult people like that. You're a junior lady who's just joined the party.
Okay. No personal comments, ladies. I don't want this at all. This is not how we debate on Mirror Now. I'm going to give both of you 30 seconds to cool off. This is not going to happen. Totally unacceptable on this channel at all. And not on my show. I'm going to give 30 seconds to the political representatives to calm down, introspect, that we're not going to be personally attacking each other at all. It's very, very undignified. Meanwhile, I am going to go back to Neelam Deo for one simple question, Neelam Deo. When we talk about COVAX agreements, the ones, the COVAX obligations, it is possible to get out of them, right? When we look at the situation back home, can we say that, no, we can't supply these doses right now because we need to cater for ourselves?
So I want to make one or 2 points. Yes, you can slow down the supply simply because of taking the position that you don't have enough. And nobody will really be doing anything about it because it's an international alliance. But I want to say the following things. One of the 2 vaccines that we're using in India, people should remember that all the research was done and it was actually designed in the UK by the Oxford University. And then with one of the Swiss companies. Now, if you don't have any international cooperation and no regard for each other, why should they give it to us to produce, to use here? That's one point I want to make. And I think all our, all the other colleagues on this show should remember that. After all, we didn't produce it. We didn't design that vaccination by ourselves.
Yes.
The second issue is, 1 minute, we are in the WTO, the World Trade Organization, at the moment with a proposal that pharmaceutical companies should waive their intellectual property rights so that the vaccinations can be produced and distributed globally at an affordable price. Why should the world community care about what we are saying? We made a big success of dealing with HIV/AIDS because we did it in cooperation with the world community, and we were able to break the IPR hold on the price of the medications, which, Cipla is world famous for that. And still people in the developing world are grateful to that company for their lives. So I think we need to remember, yes, you can break a contract, but remember that tomorrow, anything that is to be supplied to you, that contract can also be broken. And I just want to say that it is true that the United States, the UK are actually holding on to what they are producing.
Yes.
They have more than they need for their populations. But is that something admirable? We criticize those
Absolutely
countries
not.
for a lot of
I was
things.
going to say
Let
that.
us not forget
No,
that.
so I
and let us
completely agree
always
with you.
remember one thing, that the world is not ending tomorrow. What are we going to do afterwards? Are we going to enter contracts? Are we going to expect other people to fulfill them? We are right now in a problem because there is a part that the Serum Institute requires, which the United States is not exporting
Correct.
at the speed at which we require it. Supposing they say we won't send it at all, then what vaccination will we all be quarreling over?
But isn't that the other aspect as well, Neelam, though? When United States is looking out for its own people, it's hoarding all of these raw materials so that they can manufacture all of it for their own people. They are not agreeing to any or following any contracts and obligations. They don't care. And every other country is going to do
Tanvi,
that.
can I come in?
But and adding to that is the fact that we have also done so. The fact that today Serum Institute has been given a legal notice from AstraZeneca is because the government has told Serum Institute to not export. So Serum Institute is also not now fulfilling its commitments and its obligations and contracts. So our government is now doing this what we could have done earlier.
We have to reduce, but we cannot break all our contracts.
Okay. We have to reduce, but we can't break all of our promises. Yes, Charu Pragya.
Okay, the facts first and then my opinion. First of all, today onwards, the government has put a temporary stop to the export of vaccines. It's out in the news. It can be rechecked. The second point that I want to raise is that when we talk about hoarding, when we say that we're not looking after our citizens, we are looking after our citizens. As I said, we are vaccinating at a very fast pace, the fastest pace in the world even, and our vaccination drive is designed in accordance to specialists at WHO. The government is working round the clock to make sure that every single citizen is looked after, and vaccination is done on the basis of need first, not want as much. And now, my personal opinion. Do you remember when COVID struck and everybody wanted to hoard things? Do you remember what happened in the US, in the UK, when people were just running to these grocery stores, grabbing everything and hoarding? Did it help them, or did India's approach work out to be better in the long run? I can eat 2 chapatis today, but if I want to make 4 and hoard all 4, does it help me? I can make 2 more chapatis for myself tomorrow. Isn't it better for the world? Isn't it better for humanity? And
yeah, but I don't want to go hungry tonight either, no, Charu. But I don't want to go hungry tonight either, Charu, because you were magnanimous, so magnanimous that you gave all the chapatis away to your neighbors.
Can I come in?
I am not going to sleep hungry. I need the vaccine. I need it now. People have gotten their first dose. They were standing at vaccine centers today for their second dose and they didn't get it. They didn't get their second dose.
Do you know how many senior citizens have been vaccinated in Maharashtra till now? 25%.
Give us more
how
doses.
Many have been vaccinated in Delhi till now? 30%.
Give us more doses. I don't understand why BJP keeps giving this an argument for bad performance. It's an argument to give us more vaccines.
Vaccination for all.
Okay. I am not going to get involved in this. Let Shama Mohammed come and then Atishi.
They achieved the number they were supposed to achieve.
Yes.
They haven't.
Shama Mohammed.
Calling for vaccination for all is not going to help.
Shama Mohammed.
Yeah, Tanvi, for Neelamji's point, she spoke about AIDS. Now, madam, AIDS is not a communicable disease. If you want to get AIDS, it's a different way of getting AIDS. As you know, it's through sexual contact, hepatitis, those different ways, by blood transfusion, These are the ways you get AIDS. But this is a communicable disease. You don't have, if I want to get it or if I don't want to get it, I will get this disease. So, and people don't know much about it. So it is important that the country looks into saving their citizens. We are seeing deaths every other day. Now, another point which I want to make is when the strain from the UK came out, we should have ramped up increasing our vaccination at that point. This madam from the BJP says it is not about need, but it's about want. I mean, just now the health secretary said it is not about wants, but it is about needs. I don't think there is anybody, it is about what? It is all about needs. Everybody needs this vaccine. I know 18-year-olds who are now COVID positive. There are so many out there. So it depends. If there are many cases, and you mentioned about old, the highest number of healthcare workers who have been vaccinated is in Maharashtra, 80%. Highest number of frontline workers who have been vaccinated, 73% is in Maharashtra. And in terms of elderly citizens, we come fourth. So I don't understand what you're talking about, what your facts are. But what we need at this point of time is the government of India to be honest and tell us whether we have vaccination or not, because many of them have rolled out, even in Maharashtra and many other states, vaccination centers have been closed. Even in Ghaziabad yesterday, we saw on live television that vaccination centers have been closed, saying that there are not enough vaccine. And the other thing is, Maharashtra has a number of citizens or number of people living here is around 12.5 crores, but one gets 1.6 crore of vaccines. And 1 crore is given to Gujarat, which has 6 crore of citizens. That doesn't work. You need to focus on how many people are there, where it is the number of people are more infected. That should be, and leave it to the states to decide.
Okay. Actually, yes, it has to be a mix of population density and infection. We really don't know what is the policy that is being followed by the government now after they open it up to everybody above the age of 45. Quick response from Charu Pragya.
Thank you very much. So let me tell you that, first of all, there is no scarcity of vaccination. Every single month, the speed at which we are vaccinating is going up, while our production facilities are also going up. There are 7 more vaccine companies which are in the pipeline, which are going to be given the go-ahead very, very soon by the government. Listen, you're speaking over me again. I could have done the same thing. Please don't do this. I'm totally not into screaming on television. I'm going to wait for Tanvi to intervene, and I will speak when nobody's screaming over me.
Yes, Charu, finish your point.
Thank you. So we have 7 more vaccines which are in the pipeline, which are going to be given the approval very soon. As these things start happening, we are going to have a big, steep rise in the production of vaccines in our country. We are looking at not just the existing 2 that we are administering, we are looking at 7 more, and we are going to give approval to vaccines which we have agreed to buy from other countries as well. That's the first thing. The second thing is, even today, the least fatality rate is in India, and we are able to take care of that only because we've looked after certain things in a very proper way.
Okay, I'm out of time. I don't have the time for you to give us a report card of the performance in the last 1 year. Everybody knows and appreciates what we've managed to do. Fact of the matter is, it doesn't matter even if our mortality rate is low, which is a great thing, and thank goodness for that. But if you're going to go back to a situation where businesses have to shut down, migrants have to go back to their homes, people have to be locked up in their homes, then honestly we're looking at another disaster. And we need to very quickly look at a comprehensive policy that has testing and tracking, but also a heavy round of vaccination. Do we have the doses right now to ramp up our vaccinating capacity? It looks highly unlikely. By our own central government's admission, right now we have 4.5 crore doses in the pipeline that will really not sustain us beyond a couple of weeks at our current pace. So the states and the center need to again get on the table and decide targeted vaccination for those who need it the most, those who need their second dose, and then plan out in a proper manner such that we're able to contain the infection while ensuring a fair distribution of the vaccination. Look at this. Maharashtra has got 4.5 lakh fresh doses. Now, how are they going to plan without knowing when the next round is going to come and how much will it be? You can't plan your distribution in such a manner. It has to be more organized. Completely out of time. Thank you to all of our panelists for joining us. Thank you to all viewers.